Hi, it's Dr. Rani. Today let's talk about trigeminal neuralgia. So trigeminal neuralgia is a chronic facial pain syndrome. It affects one half of the face, and usually it's the upper cheek that's affected, sometimes behind the eye, sometimes even the forehead. And when people have trigeminal neuralgia, they feel an excruciating severe pain. It may be like a burning sensation, it may be a shock-like sensation, or even like a stabbing sensation. And this pain can come and go. Usually there are clusters of pain, so it can happen multiple times a day for days or weeks or even months on end. Sometimes the pain may actually disappear for months or even years and then come back again. So why does trigeminal neuralgia happen? Well, we think it's because the trigeminal nerve, which is a very large nerve deep within your brain, sits up next to a little blood vessel. And every time your heart beats, that blood vessel pulsates. And every time the blood vessel pulsates, it hits up against the nerve and it irritates the nerve to trigger this pain sequence. Now, who gets affected with trigeminal neuralgia? Usually it's people who are above the age of 50 and in particular women. Now the next big question I know you have is, how can we treat trigeminal neuralgia? The good news is that there are some great treatment options that are very, very effective. So stay tuned for my next video when I'm going to share those treatment options with you.